And ready to go already. Dr. Payne Show. Hello. We are here. We're here for you. 416-870-6400 star 640 on cell. Lines already open. You have health concerns, pain concerns, bring them on. That's why we do the show here each week. And Dr. Lou, how are you, pal?
Good. John, you sound sick.
I've been fighting some for a week or two.
Yeah, I was going to say, you sound different than usual. That perfect radio voice of yours is a little different. You okay?
A little grovelly this morning.
Yeah.
We've been doing movie trailers. No, I'm hanging in there, buddy. I noticed, because I'm on your list,
Look
that
at you.
Pinpoint Health Social is social media is starting to take flight.
Yeah,
nice.
Very important. We got a great company working with us to help with social media, so make sure to follow us on Instagram or Facebook. You can follow us, either type in Pinpoint Health, or you can follow myself, Dr. Lou, or Dr. Lou Nally, depending on it. The last name is Nalli, but if you type in Dr. Lou Pinpoint Health, you'll get to it. Lots of great stuff that we're putting out there. Again, an extension of this radio show. What we're really trying to achieve is give the visual aspect to what we do here. A lot of things, and I often will say when we take calls, I wish I could show you what I'm talking about. And so we're going to have tons of cool stuff that comes out on social media. And again, with one primary objective, and that's to provide the information to everybody so that they can get better. And that's why I do what I do. It's really to just provide the best information so people can get the best care. In fact, I was seeing Thursdays are my really, really busy day with assessments, where I do assessments all day. And I was seeing a patient, and after they were done, they had mechanical low back pain. They needed to go for therapy. And they didn't drive, and so none of the locations that we have were overly convenient for them. But they needed quite a bit of therapy. This wasn't just something that it would be a few weeks. It was actually going to be substantial. And I actually referred him to another chain of clinics, which I'm not going to say because I'm not going to advertise for someone else. But I do know that this chain of clinic provides great care. And I said, go to this clinic that's just up the street for you. And then he said, oh, do you have a financial interest in that place? And I said, nope, not at all. It's just, I want you to, and he was so surprised. He's like, wow, you're not even going to try to convince me to come to one of your clinics? I said, no, because the biggest thing with this stuff is adherence as well, right? And if you're making it hard for people to get where they need to be, it's just going to decrease their prognosis. And that's not my primary objective. Of course, I would love for everybody to come to our clinics, but if you can't, that's fine. There's a lot of great clinics out there as well where you can get the right care. The big thing that I always talk about is just make sure you're not going to the bad ones, right? The red flags, the places that are not doing the right type of care. But there are good places out there for the right type of care that everybody needs. And so, I just remember it really stuck out in my mind where he was so impressed that I wasn't, and even when people live, next door to one of our centers, I always tell them, you can come here, but you can also go anywhere you want. I don't force anybody. I don't use scare tactics to say, well, you're not going to get the right care if you go No, do your own due diligence. I can't guarantee that you get the right care somewhere else, but you may very well get the right care, and that's fine. All that we want is for people to get better, get the right answers to their pain and injury problems, and go from there. That should be the objective. And if we do it that way, then people will get better. And you know what? They'll remember me at the end of the day that I made that advice. So I'm sure they'll refer someone else. And so it's fine for me. So, social media, I sort of went off on a tangent there. I remember your original question there, John. But yeah, social media, the big thing here is providing the visual aspect, an extension of what we do here on the radio show. So make sure to follow us at Dr. Lou or Dr. Lou Nally, or, of course, Pinpoint Health.
Again, 416-870-6400 star 640 on cell. Just a minute here before we break. What's been happening in the office this week? What else?
The consistent stuff that we're always seeing. We had a lot of knee patients coming in this week. We ran a show, I believe, a couple weeks ago about knee pain, and so that's always continues to be a big thing in getting the right answers. I've actually sustained my own knee injury as we speak, so I'm trying to deal with it. But the beauty, and I was like, I was hobbling around and someone was like, "Oh, what's going on?" And I said, "Well, there's a chance I may have torn my own meniscus." But the great news is I'm going to have that assessed on Monday by one of our doctors. I try not to be my own doctor, and just the quality of care. And they're like, wow, that's amazing that, that's the advantage of what you do. You can get yourself in so quick. And I said, no, that's the advantage for anyone that comes to our services. We get you in as quick as possible because we really want to make sure that helps with prognosis. So this isn't just a benefit to me, the president of Pinpoint Health, it's a benefit to anyone that comes to Pinpoint Health. So any knee problems that you're sustaining, especially acute, the big thing here is the acute stuff. We get a lot of calls, and I'm happy to see every type of knee injury, the chronic stuff. But people often, when we're expediting stuff, it's because it's an acute injury, because that's where you intervene. If you've had knee pain for 5 years, it's likely arthritis, it's a multitude of different things. You don't necessarily need to see a surgeon tomorrow. In fact, it may not even be surgical, but definitely in acute settings, especially if you have things like immediate onset of swelling in the knee, any locking, especially of the knee, or any substantial click with pain. If you have any of those three symptoms, you definitely want to give us a call as soon as possible, especially if this just happened, because there's a high chance that probably requires surgery. And if it does, it's to your advantage to get in as soon as possible.
And good opening salvo there, my friend. We'll take a short break. And the phone lines, by the way, are already open for your calls about your health concerns or pain. Bring it on, 416-870-6400, star 640 on cell as well. Dr. Payne Show just getting warmed up right here on Global News Radio. And we are back at it indeed, and plenty of time for you to call in, ask your health questions. If you're got some knee pain, any other pain, bring it on. We'd love to talk to you right till about close to 12 o'clock anyway. Yeah, 416-870-6400, star 640 on cell. You know, we mentioned off the top, Dr. Lou, that the Pinpoint Health social media is up and running, and it was really cool. The other day I was on there, and you sort of it's interesting because it's not just information; there's also good video content up there as well. And you put one about a Nordic hamstring stretch, and this just goes to show that, hey, you know, a lot of guys are seasoned in the gym, but don't always run out and just show yourself how to do something. Sometimes you need some proper training with stuff, right, for a practitioner like yourself, right?
100%. And if you notice in that video, it's not even me, right? So I realize I have an amazing team. The team that we've put together is absolutely incredible, and the knowledge that is shared amongst all of us is amazing. And I make sure that I tap into that knowledge. I want the expertise of these other people. I'll be honest, there's people in my team that are better than me for certain things. I'm sort of the lead here, putting the pieces together, but you can rest assured that when you've been referred to someone in my team, you're going to get the very best care, and you're going to see a lot of that on the social media too, where we're going to be taking people who are experts in individual fields and utilizing their knowledge, because I don't know everything. I'm very, very honest about that. I don't know everything, but what I do know is that if you have a group of right people and great people, you're going to get all the information that you need, and that's what we really try to achieve at Pinpoint Health. Is we've tried to put together a team that has all of the services that you can imagine for pain and injury treatment and prevention, right? So we have everything from chiropractors, physiotherapists, massage therapists. We use integrative medicine approaches like naturopathic medicine, acupuncture, but we don't forget the conventional side of medicine when things like orthopedic surgeons are necessary, sports medicine physicians. It's an all-encompassing approach to pain and injury. We tackle it from every single perspective. We have dietitians and nutritionists focusing on that stuff. We have mental health consultants when we really want to focus on the chronicity of things and the mental and the psychosocial component that affects it. So we make sure that we have everything that we need at our disposal for one main goal, and it's just the proper treatment of the patient. And in going off on that little bit of a rant there, one thing that I wanted to bring up, which is, and it's a pet peeve of mine, and you're going to know as soon as I mention it, John, it drives me crazy. There were about three or four assessments that I did on Thursday that were people that had surgeries, and now they have sort of pain that's been lingering from those surgeries. And, you know, anytime someone tells me that they had a surgery of some sort, it doesn't matter where the surgery was. My next question is, did you do rehab before and after? Yep. And I'll be honest, you know, 90% of people say no to the rehab before, the prehabilitation, which is like, okay, that's fine, but definitely you definitely would like to hear that 99% of people are doing it after. Sure. And there were people that were like, no, I didn't do any rehab after. And that's not, I mean, that's a problem, but that's not my pet peeve. The pet peeve is this: when I said, well, why didn't you? Oh, my doctor said I didn't need it. And it's like, it just drives me crazy. It's like, you know, one thing that I always say is physical problems need a physical intervention. And this idea of just, you know, laying in your bed and rest after surgery is the wrong approach. It is the wrong approach. And if you do that and you're not feeling well years down the line, don't be surprised. And if you don't know, that's different, right? But if you're hearing this and you're going through this right now and you're not doing anything, you need to be doing rehabilitation following your surgeries. It is so important for prognosis. surgery is controlled trauma. When that trauma happens, things start working differently. When they work differently, we need to get them working optimally again. And that's what rehabilitation is. It's finding the optimal function of the body. And that doesn't go for just after surgery. There's also a ton of people that I see, I sustained low back pain. I hurt myself. I actually saw a person, this is a great example, hurt their back at work, a manual type of job. They went to their doctor. They were given some medication. And this is like 3 years ago. And all of a sudden, I was saying, have you done any therapy? No, I never did any therapy. My doctor told me I didn't need it. And it's like, it just drives me bonkers. I can't believe that is the approach and that there's still people out there recommending that. And anybody that calls themselves an evidence-based practitioner should know better and know that you need to intervene with physical medicine. It's the best approach. It's the safest approach, especially for these things. I'm not saying medication is not necessary. It may be part of it. But definitely if you can minimize that, that's very important. And this idea of complete rest should be thrown completely out. There's no, unless you're in a coma, I can't think of too many scenarios where you need complete, absolute rest. A lot of the times we're talking about active rest, and that's an important distinction. We're not talking about not doing anything. We're talking about doing some stuff that's the right stuff, avoiding the stuff that's the wrong stuff, but make sure that you're moving a little bit. Our bodies are not designed to not be doing anything. They are designed to be doing something, and in doing something, we can do a little bit more and a little bit more, and we can work back towards what we were doing. But it's such a pet peeve of mine. I can't believe that it still happens, and I just wish that it stops. And again, if you're listening to the show, if you've listened to the show, even if you haven't seen me, but you're about to undergo surgery, and you were thinking, well, my doctor hasn't recommended anything in terms of post-operatively, go do your rehab. I don't care where you do it as long as it's a good place, but make sure you do your rehabilitation. It's very important.
We'll take a short break. Robert, I see you there on the line, and your calls as well, 416-870-6400, star 640 on cell. We'll get to our calls and continue our discussion here after a wee break. It's a Dr. Payne Show on Global News Radio. The Dr. Payne Show, 416-870-6400, star 640 on cell. As always, calls are top priority. Robert, thank you for hanging on through the break, fella. Good morning. How are you?
Hi, how are you doing today, buddy?
Good, sir. What's going on with you?
Nothing much. Honestly, I want your opinion because I've gone to my doctor because I've had fibromyalgia in my knees and I've had chronic back pain for the longest time. And honestly, it worries me because all the time the doctors are trying to medicate me, and I don't want to be taking all this medication. I don't know the long-term effects of it. So, what do you think the best solution would be? A more natural approach?
Yeah, so I mean, fibromyalgia is a complicated thing. There's not one thing that you should be doing that will make fibromyalgia better. It's sort of something that's due to a multitude of things, which means you sort of have to do a multitude of things to get it better. Let me start by asking you, who's diagnosed you with fibromyalgia?
My doctor, and I've gone to plenty of specialists. Okay, so
a rheumatologist or somebody has said that you have fibromyalgia.
Yeah, I couldn't remember the name.
Right. Okay. That doesn't matter. I want to make sure, like a lot of times you'll go see someone and on day one they say, oh, you have fibromyalgia, but fibromyalgia is a diagnosis of exclusion. And really when we start breaking down the word, fibromyalgia just means fiber, muscle, pain. That's it. So it just means you have pain, and it's not due to anything that we can identify structurally. So when you look at fibromyalgia, it's sort of, there's a couple prongs in terms of what causes fibromyalgia. So a lot of it has to do with some type of physical trauma that happened to an area. It has to do also with a lot of psychosocial stuff about the patient. So things like depression, anxiety, poor sleep will affect that as well. Do you have those things?
Honestly, I sleep about 3 hours every night.
Right.
I lack of sleep every day. I've tried different methods and everything, and it doesn't work. And again, I don't want to take medication because that the doctor's trying to prescribe. Because again, I don't know the long-term effect. And in the end, when I do take it, I don't feel like myself.
Yeah. So one thing. So the psychosocial, the mental component around fibromyalgia is very, very important. The medications for fibromyalgia are very much designed to depress the nervous system, because fibromyalgia is essentially due to a heightened state in the nervous system. And so these medications are designed to dampen that effect on the nervous system. But the reality is once you dampen that effect, you're going to dampen things like your awareness and other things that are due to your neurology. So the other thing that I often suggest, and I'm not saying don't take the medication, but there needs to be a transition. What you're really trying to do is trying to control the psychosocial and the physical aspects. So, things like cognitive behavior therapy can help you control that mental aspect, and various forms of therapy can help you control the physical aspect. And that doesn't necessarily mean you'll be completely off the medication, but you may be able to find a balance of things. And that's the thing about fibromyalgia. It's not something that you're going to cure. It's something that you're going to manage, but you can manage it by doing a host of the right things. And so that means targeting the physical, targeting the psychosocial, and targeting potentially the biochemical. So, the goal should be to sort of wean off of those things as the other things become stronger. I think a good thing, Robert, is come see me for an assessment. We can go through this more in depth. I can't do it justice over the radio here. You need a proper assessment, and in that proper assessment, we can then provide you with the proper game plan on how to target your fibromyalgia.
Robert, appreciate the call. It's 1-855-55 Dr. Luke DRLOU to reach out. Do it that way for sure. Get to Avril. Hey, Avril, thank you for hanging on. How are you?
I'm good, thank you. How are you?
Good. What's your concern?
No concern. This is
Okay.
praise for Dr. Lou.
Oh.
I've been to see Dr. Lou. I listened to your program probably a year ago.
I remember you from your accent, in all honesty.
Okay, so as you remember, I came to see you. Like the caller before, I also had fibromyalgia.
Yep.
I had severe backache. I'd had MRIs and was considered to have severe back problems, scoliosis, all the names that you can think of,
right.
stenosis, etc., etc. And I followed your advice to a T.
Okay,
I don't know
awesome.
if I'm allowed to say where you sent me.
I'm sorry?
I don't know if I'm allowed to say where you sent me.
Okay, yeah, you could say whatever you need to say.
Okay, you sent me to Dr. Golden.
Okay, yep.
At the chiropractic center.
Yep, at the chiropractic college, yep.
I've been going there 3 times a week. It's actually reduced now in time.
Yep.
I go for therapy. I follow the exercises daily.
Yep, awesome. That's very important.
Cardio daily.
Yep.
I do mindfulness and meditation.
Great.
I'm off all the medication.
Great. And the important
medications.
thing here is you're doing better.
I'm doing 100% better.
And that's
and so I'm
yep.
calling to thank you, first of all, but also
You're
to
welcome.
give hope to other people who are listening and might be skeptical or just don't call in and think
Yep.
that they can't get better because they can.
But there's a caveat to all this, Avril. I have to thank you because the thing about this stuff is I can impart my knowledge on you, but the most important aspect here is you followed through. You're doing the things that you have to do. So I can simply give you a suggestion, show you a path, but you need to, metaphorically walk down that path and do those things. So, make sure that you thank yourself too, because you're doing it. And that's the important part. We're just the healthcare team that is helping guide you through that. But your disposition is what is making you get better. The fact that you want to get better and the fact that you're doing those things. And that's what I hope people hear in this phone call is that they hear that you, the person, need to be willing to get better.
Correct. And also, it's no use just going to all of these things without listening to what they say. Like,
of course.
Like the exercises, you have to do it like they tell you daily.
Yeah, you're absolutely right.
It just doesn't work. It's no use just going about doing these things, but not putting your heart and soul in it, because it's you who wants to get better if you want to get better.
Right. I love it, Avril. Thank you so much for the call.
Well said, Avril. Appreciate that. And there you go. Gets results when you follow the instructions, right? John, I see you hanging on the line. We'll get to your call and plenty of time for you as well. 416-870-6400 star 640 on cell. Dr. Payne Show, Global News Radio. You still have plenty of time to call in and ask your questions about your health. 416-870-6400 star 640 on cell. In that regard, we'll get to John. Hey, John, thanks for hanging on. Good morning.
Good morning. Wonder if you guys can help me out with a question here. Late 50s,
Sure.
In good health. I don't take any medication at all. But I've had a lower back pain for the longest time, and I have a desk job in front of a computer for most of the day.
Yep.
But I find that it gets aggravated even more. Playing sports, soccer specifically,
Okay.
and ball hockey. Now, it's a lower back pain, and when I've gone to the doctor, he'll have you, stretch or move, and says, well, it's a bit of inflammation, and you've got to stretch before you do any exercise and whatnot. But I've noticed now that even on the left side, like mid-thigh, right where your bone is, if you press in, it almost seems like a bruise. And I did do if I get massage therapy or acupuncture, it's relieved temporarily.
Right.
And then now something really peculiar is happening, almost like on the left foot, almost like a heat. You almost feel like the foot feels warm.
Right.
I don't know if this is a nerve or something, but the girl at the massage place said, I don't think it's your back. She goes, I think it's more in your glutes, because when she pushes in there, it's really sore and tight, really tight.
Potentially. Yeah. I mean, so outside of the massage therapy, have you seen anybody else about this?
No, and this is why I thought, okay, at this point now, it was always there. If I drive my car for any considerable distance, once I got out of the car, it's like, oh man, I just need something. It almost feels like it's got to be the thing is wound up so tight. I can't even touch. I can go halfway. The doctor asked me, "Can you touch your toes?" And I couldn't. I can get just a little bit past my knee.
Yeah.
And it just feels like my hamstrings, calves, everything feels really, really tight.
Right.
And the funny thing is, playing sports, in the beginning it's painful and whatnot, but as the game progresses and as you're warming up, I
you
guess,
feel better.
It feels a bit better, yeah. And it's I don't take medication. I mean, the odd Tylenol, but
Right.
I can't take ibuprofen. It's not good for my stomach. But I'm just curious, is this something that? And he says, I'm not taking. It's not good to take X-rays. Just leave it alone, like that type of stuff.
The X-rays may not provide that much information. So to me, it's obviously I need to assess you if you want a formal diagnosis. But I think that should be step one. In all honesty, I think. Everybody sort of diagnoses low back pain as just like, oh, it's pain in my back, and that's potentially it. I'll give you the spiel that I sort of give to most people. 95% of low back pain cases are what we call chronic mechanical low back pain.
Yeah.
The reason why we call it that is because it might be a muscle, it might be a ligament. It's some type of soft tissue injury. Yeah. Whether it's the ligament or the muscle is actually very hard for us to distinguish in the medical profession, but it doesn't matter because the treatment for that is the same. There's 5% of cases where you can get other things that we can specifically identify, like a disc herniation, stenosis within the spine, or very, very scary things like tumors, things like that. Now, just based on, the biggest thing, I think it was William also that said if you listen to a patient, they're telling you their diagnosis, right? The 95% of a diagnosis is just done by hearing a few things. And you really use your physical exam and special testing to confirm or deny that suspicion. And just based on what you're saying, I would definitely lean that you're probably the 95%. The reason why I'll with an asterisk, you're saying I'm not diagnosing you because I can't rule out the other 5% over the radio, of course. But when it comes to the 95% of chronic mechanical low back pain, which is what causes 95% of the low back pain problems that people have, the answer is this. In the acute scenario, the passive therapies like the massage therapy, the medication, manipulation, IFC, ultrasound, those things very much help in that acute flare-up stage. But that chronic low-level ache that you're talking about has one thing that helps it, and that's proper rehabilitation of the core and the glutes. And if you don't make that area strong, then you're going to continue to have these problems going forward. They're likely going to become worse in intensity, frequency, and duration. So the big thing here is the rehabilitation of the core and rebuilding the musculature. Because if I showed you a skeleton right now, and I took away all your vital organs, your low back is just a pole with nothing else around it except muscles holding it in place. And if those muscles are weak for whatever reason, because of deconditioning, because of sitting for long periods of time, or just the natural process of aging or whatever, you're going to experience chronic mechanical low back pain. But if you can rebuild the strength in those muscles, you're going to manage it extremely well. It is, I can't stress, like Avril was just saying, the exercise rehabilitation hydration component is, in my opinion, the most important component of chronic low back pain that is missed. And if you do the right things, come see us. We can show you all the right things to do. You can work with our team. But the big thing about this is you need to do it every single day. And this isn't, when you have chronic mechanical low back pain, it's like if I said you have diabetes. You're not going to take, metformin for the next 2 weeks and then be off of it because you're cured. It's not a cure, it's a management. You're going to have to keep doing these things.
I was going to ask you, when you get that feeling of, like I said, in the left foot, a bit of that, like the intermittent.
Yeah, the burning. Burning is definitely a neurological symptom. Now, that could be muscular. It could be a disc issue. There's a lot of things. That's why I'm saying that 5%. I can't rule that out. You're not saying some other big characteristic things that would make me say, you definitely sounds like a disc herniation. So, a lot of that can just simply be related to the syndrome of the chronic low back pain that causes muscles to tense, and that could put pressure on peripheral nerves, and that can create that type of burning sensation. And burning is definitely a neurological symptom, but that doesn't mean it has to be a disc herniation. It could be a lot of different things.
Yeah. Like I said, if you're sitting on a chair and you sort of put your left leg, you're leaning it or trying to, let's say you're trying to sit cross your legs on the floor. There's definitely a pulling in the thigh muscle. You can actually feel a pulling. And it almost feels like a bruise, and like the bone is bruised. But it's weird because it's not consistent. Like if I'm doing gardening and I'm bent over for 15, 20 minutes picking up weeds or whatever, to straighten up, it just feels so incredibly tight.
Yeah. The unfortunate thing is it doesn't matter who you are. If you're bent for 15 or 20 minutes, it's going to be hard to stiffen up because our body undergoes this thing called creep, where those ligaments and muscles start to elongate, and they're really not meant to do that, in all honesty. So, that's also part of the treatment, is the education of the things that you should and should be doing, or shouldn't be doing. That I'm not saying you shouldn't be gardening, but there's probably better tools that you can use, things that you can modify, because nobody should be bent down, picking up weeds like that. It's not good for your low back, and that's what will create injuries. And if you've been doing that stuff throughout your whole life, then it sort of makes sense why this deconditioning and symptoms have progressed. But I think you need to see me or anybody that you trust for that point. But you need to get it looked at. And I always say the diagnosis, the right diagnosis equals the right treatment. So let's get you that right diagnosis.
Here you go, John. 1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com to reach out and carry on. Please do so. We'll return and get to more of your phone calls. You still got some time. 416-870-6400, star 640 on cell. Dr. Payne Show, Global News Radio. Yeah, you still got time to call and ask your questions like we've been answering so far. Yeah, 416-870-6400, star 640 on cell. And you can search and go Pinpoint Health on social. And if you're on Instagram, want to mention this as well. This is really cool. You take excerpts from this radio show on hashtag Truth Tuesdays, and we talk a little bit about what we talk in the show, which is excellent stuff because people have access anytime, right?
Yeah, 100%. And Adam, who's running all the social media, is really pulling the stuff, I guess, that will resonate with people. And just, there's a lot of things that I say that if you can keep the repetition of hearing it over and over again. Like, really, when you think about it, a lot of things, it's not like I'm giving new information every week. A lot of the times it's just the repetition of things and making sure that people are really ingraining this into their subconscious and understanding these things is so important. And when I hear, I think back to Avril calling, which was not staged or anything like that. But
I remember her, though.
Yeah, but it's just, I love those stories where people, and I saw her one time, and I recommended her to somewhere else, and she's been getting the right care, and she's doing the right stuff. And people will often call me to thank me, but they don't realize how important it is that they're doing it, right? I'm recommending this stuff to whomever's coming to me, but I love hearing the stories of the people that actually want to get better, because when you that component of wanting something is so important, and it's so hard to describe how much that matters versus people I'll get people that come in and they say, oh, I'm here because so-and-so sent me, but you can't help me, nobody can help me. It's like, it doesn't matter what I'm going to say to you, right? Like, you can't change that type of mentality, right? And I try, and I'll have that discussion about that, but but the want is so very important. And when you really want to do something, when you want to achieve something, you will, because you're determined, you're focused, you're dedicating your resources, your attention to an objective. And when you do that, I think the human potential is endless in that regard. And so I'm so happy to hear Avril is doing better, and that she's, in her own words, 100% better. And like I always say, there's no cures, and she's probably not cured, but she's managing it so that she feels cured. And that's incredible. And it's just, it makes me very happy. It's great to hear. Yeah.
Yeah, she's done really well, and I can tell you from a personal standpoint, as you know, you treated my sister-in-law, and I asked her. We had coffee last night, and I said, "Cammy, you still do?" She goes, "Every night, like absolute clockwork." You know how long that? I think it's been over a year. Yeah, still does it every night. And she's still reasonably pain-free. She's managing no problem, but it's about consistency. It's like you don't just brush your teeth once; you do it every day.
Yeah,
you know
exactly.
What I mean? It's the same type of thing, right?
Yeah, you have to keep up with these hygiene aspects for the musculoskeletal system for sure. Great analogy there with brushing your teeth. If you do that stuff, then you're going to do very, very well with therapy and with your pain and injury issues. And if you don't do that stuff, especially when it's chronic, like that's the big thing to stress here is with the chronic stuff. That really becomes the answer, is the day-to-day management with different types of exercises, different types of stretches, different types of movements, but also avoiding certain things, right? Like I could show you all the exercises in the world to do and build your core up to be so strong. But if you're going to bend and twist and pick up bricks, you're going to throw yourself out, right? Like that's just, there's certain things that our bodies are not meant to do, and it's important that people understand those things. And so that repetitive, that repetitive strain sprain presentation is so important. Like I see a lot of people that like say something like carpal tunnel, where they're typing all day, and we're giving them recommendations on what to do. But again, if you don't modify the way you're actually working at that keyboard, because there are ways to modify it so that you can keep the symptoms at bay. But if you don't modify that, it doesn't matter how many exercises you do, the braces that you wear, the therapy that you do. If you're aggravating it for 8 hours a day, like it's not going to be a surprise that it doesn't get better. And so modification is an important aspect of a lot of things. And that's, even for athletes, that when we treat high-level athletes, we're not telling them not to. A lot of the times, we're not saying don't go back to your sport, don't do those things, because they want to return to play, and that's our objective for them too. But sometimes it's about, okay, well, how do we modify this so that you can continue doing it, you can continue to be successful at the sport that you're playing, but you also keep your body safe. And that's an important aspect of what we do at Pinpoint Health too, is modification to suit you in order to continue doing what you want to do.
It's so amazing too. It's people. There's a certain amount you can learn from friends. There's a certain amount you can learn online. But I see every day guys and women alike in the gym performing moves where it's like, man, you shouldn't be doing it that way. You really need to seek help, whether it's through you or a member of your team, because it's so easy to go out and watch a video and think you've got it mastered, and boom, you injure yourself, right? Then you're back beyond square one. You've even put yourself back further.
I could tell you I love to read, and I read a lot of things. And when you're reading like things about wealth and stuff like that, a lot of the advice is always make sure you have the right professionals. You have a great lawyer, great accountant, all of those things. I really think that goes for all of life, right? Like you have to have professionals, and working out and doing things is no different. You can't. It's not things that you just figure out. And you're right. You can watch videos, you can pick friends' brains, but there are times where it probably is a worthwhile investment to have the right person showing you the right things that you do, because it's an investment for prevention of injury. So many things go wrong with injury, and it's all the consequence of, well, you've been doing this wrong for so long that you've been breaking down an area. And if you break down that area, it's no surprise that one day you're going to be in a tremendous amount of pain, and you may not be able to do that anymore. So, yeah, I totally agree with you on that, John. I agree that I think for everything in life, like there is an advantage to having professionals do things. Like you wouldn't just build an extension to your own house, and if you do, I'm not sure how that's going to turn out. You would often hire a professional, right? So I think that idea of everyone has this specialized knowledge, and if we can all utilize one another for each of our individual specialized knowledge, I think that's really how you get ahead in every aspect. But definitely agree on that side that, for some reason on the physical aspect of things, people sort of think they could do this stuff on their own, even with their injuries. Well, I'll just take care of it on my own. And, there's no kind of calls that I get of people saying, like, I've been doing my own stuff. I've done my own research. I know what it is, and I've been treating it. It's like, you don't know what it is, though. Like, you can't be certain. And something that's even worse is when people are picking other people's brains. Who did I have this week? They were coming in and saying, like, an aunt or something had told them what they should be doing, and they were getting worse. And it's like, come on, like, don't just listen to your aunt about what you could be doing for your low back pain. Like, go get a professional's advice on this stuff. Not all low back pain is the same. This person may have had good success doing something, but not all low back pain is a result of the exact same thing. And that's the important component, is to distinguish these things, and treatment needs to be individualized.
We'll take a short break, last one, before we wrap it up here. So you still got a few minutes to call and have your comments and questions about your health. 416-870-6400 or star 640 on cell. Dr. Payne Show, Global News Radio. All right, as we carry on here, Dr. Payne Show, 416-870-6400, star 640 on your cell. Info at paincarecanada.com. You want to reach out on social, Pinpoint Health on Instagram and Facebook. Lots of valuable information and good stuff, from pointers to videos to everything else on your social, pal. So good on you. That's really,
thank you,
really building well. How's the knee clinic doing, by the way?
It's good. Yeah. I mean, again, we're servicing people to get better. We see both acute and chronic injuries to the knee. I mean, I'll be honest, the vast majority of chronic issues tend to be older people and a result of arthritis.
Sure.
And so there's, a limited amount of things that can be done at that point outside of a knee replacement. But there's definitely ways to manage it until that point. But definitely in the acute scenario, if you've had some sudden impact for whatever reason, these things typically with sport-related things or some type of play, if you have immediate onset of swelling, a pop that you heard when something happened, locking of the knee, you definitely want to give us a call, get you in right away to see a knee specialist. Those symptoms may often require surgery. And again, here's the thing. We're not pushing everyone for surgery. If we can do stuff to avoid surgery, that's everyone's goal, even the surgeons that work with us. But sometimes it might be the only answer or the best answer. And if you need that and you're willing to go through with it, then getting in as soon as possible is only an advantage. It's not a disadvantage. It's going to improve prognosis greatly, and you're going to be more likely to just get back to normal quicker, and that's an important thing. So definitely any of those acute injuries, make sure you give us a call. But again, it's not just the knee. We're dealing with the whole body here. We see things, foot and ankle issues, knee issues, hip issues, low back, upper back, neck, headaches, shoulder pain. Jody was just asking about his trap pain that he has from working on the board here. So we deal with all these things, and a lot of these things, really, a lot of the times it just comes down to good advice and doing the right things. You don't need a heck of a lot of treatment. This doesn't need to be, for the rest of your life. It's just you have to do the right things for the rest of your life. That's the distinction that I really try to make. And I think it's an important thing that people get in as soon as possible. And I say that a lot, and unfortunately, I don't know that it sinks in to everybody, because people will say, "Oh, I've been listening for a couple of years, and I finally decided to come in." But it's like, stop that. Just get in as soon as possible. That's not the only reason why I say that is because the sooner you get in, the more likely you are to get better. Like, when things become chronic, it becomes a totally different monster, and it's so much harder to deal with. And I wish I could spend like 4 hours just talking about the things that happen, like the neurological things that happen when something becomes chronic. Because if you understood that the way I understand it, you'll understand why it becomes almost impossible to get rid of these things. But in the acute scenario, like in the first 4 to 8 weeks of something, if you can intervene at that point, your chance of success is so much higher than when you let it go past that point. So please, in those acute scenarios, give me a call. Get in to see us, me, someone in my team. It doesn't matter. Or again, anybody that you trust. It doesn't matter. But make sure you're getting these things dealt with in the acute scenario if you can. It's very, very important.
Yeah, the difference between letting something go for 30 days and 30 years can be massive, right?
Yeah,
especially
I'd say
when it comes to treatment. Wow.
Yeah,
just crazy.
Yeah,
just
for
crazy.
Sure. Yeah, and it's just, yeah. I mean, one of the things with Pinpoint Health, we have the 3 pillars of rehab, therapy, and wellness, and really the idea behind that is that rehabilitation is the process by which you restore or find optimal function of the body. Therapy are the interventions that we talk about all the time to achieve that aspect of rehabilitation. And once you can achieve that, you can move towards true wellness. Like, we had that gentleman that called and said, I'm very healthy, I'm not on any medication, but I got this chronic. Well, then you're not truly well, right? Like, there is still something there. Imagine how much better you can feel by even managing these aches and pains, in the low back. It's great that you don't have any other health concerns, but why not move towards true wellness, right? Which is just truly being healthy and well in every aspect, mentally, physically, and socially. I think that's such an important thing, and that's what Pinpoint Health is here to do, and soon we'll move everything over to Pinpoint Health. This will become the Pinpoint Health Show very shortly, and the reason why is just so that we can keep hammering in that name, so that you can have a place that you trust that has, the accountability to make sure that everyone's getting the right stuff. In the same way Avril called with praises today, we don't stop people from calling with complaints, and we haven't had any. So I think that's a testament. And if there are any, I always say this, I want to hear them. I want to know what we can be doing better. A lot of times these things are not malicious. It's just miscommunication. There may be something there. But our big objective here is just to help people get better. And this show, I think, provides a certain level of accountability to me and my team, because anybody can comment. And, we have Google and Google reviews. Again, we want to hear the complaints, but we're willing to work with people on these things. And anytime something happens, we always try to make the customer as happy as possible. Because, again, especially when you're dealing with trying to make somebody feel better, the last thing they need is to be arguing about some petty thing. Like, that's not our objective. Our objective is to get people better and make it as hassle-free as possible.
Before we go, just give them a basic breakdown of how it works with the first visit and then the assessment after that. Yeah,
so give us a call. That's the way it starts. And then typically you come see me for an assessment. It takes approximately an hour, and we go through everything. And then we come up with a game plan on how you get better. And, the big thing is you got to follow that game plan. If you follow it, you're likely to get better.
You bet. At Pinpoint Health on social, check it out. It's building every day. Lots of good content on there, and we'll be back here next weekend. 1-855-55 Dr. Lou, DRLOU. And for now, info at paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio.